Thank you for joining us in our new episode of Mofeed-19. I am Hesham Sallam. I am joined by my co-host, the scholar, the politician, the yogi, Hamzawy. In today's episode, we are having a discussion of the media coverage of the COVID-19 pandemic in Egypt. We are joined by award-winning journalist Lina Attalah, who is also the editor of Mada, Masr, one of the most prominent and leading independent online newspapers in Egypt. Lina, thank you for joining us.
Thank you, Hesham, and thank you, Amr.
Lina, many observers have argued that in countries like Egypt, rulers have used the pandemic as an opportunity to prop up their own power and to add greater restrictions on civil freedoms in their countries. How would you interpret that perspective?
I think this has been a classical thesis in trying to understand or to retrieve a connection between authoritarianism and the state handling of the COVID-19 crisis. But from sheer experience, I don't necessarily feel this has been necessarily the case in a country like Egypt, in the sense that the well-established infrastructure of authoritarianism that's been evolving in different forms and ways throughout the past years, in particular, that there was no need to resort to the pandemic and precautionary measures surrounding the pandemic in order to extend authoritarian practices. Of course, I say this while there have been circumstances where there have been the specific cases of restrictions on prisoners' rights, which are already extremely restricted anyways, whereas in the broader sense, I don't necessarily feel that in our case, the pandemic has been used in order to further restrict freedoms, just because the infrastructure of authoritarianism has been already in place, and my sense that this is an argument that's more tied to Western-style democracies that have had to deal with unprecedented levels of restrictions on personal freedoms, freedom of movement, and so on.
Thank you so much, Lina. It's a pleasure to interview you. Looking at reporting in Egypt about COVID-19, what are the key challenges that you've been facing and your colleagues in Mada Masr have been facing in covering the pandemic?
There have been many challenges, first of which is that this has been simply a new experience for us. Our generation has not been through a pandemic before, so we don't have knowledge in place as to how to deal with this situation. And then there is the more classical problem of access to information, which is very typical in a restricted environment.
And how did you and your team deal with these challenges, Lina, especially the lack of reliable information?
So at the beginning, when we were starting to deal with the lack of numbers, we felt that there's no way we could retrieve a way to produce alternative numbers, for example. So the game of the numbers became very hard, especially, again, in a country where you have, millions of people, you have a huge disparity in terms of access to the health system. So you can't really tell who's sick and who's not sick. And whoever is counted as sick is the person who gets access to health services, and whoever gets counted is whoever the government decides to count them. So there are those several filters and gaps to getting the right numbers. So it became clear at the beginning that doing the usual counter narrative to the state narrative was not going to be easy, especially in this numbers game. So this is when we started feeling that at the beginning, perhaps what we need to do is think less of the pandemic as an event, and instead to turn it into a lens through which we can investigate so many things that we knew very little about and became much more revealed in light of this crisis. So at the beginning, our coverage was marked by trying to go to specific communities and investigate how the initial lockdown measures affected them. And it was, for us, an amazing opportunity to produce records on poverty, for example, records on underprivilege, on what does it really mean to be underprivileged? What does it mean to be vulnerable? It was also a fantastic opportunity to investigate in depth the health structure, be it at the level of the establishment, but also on the level of the different communities of doctors. And also what kind of attitudes and behaviors started evolving amongst the doctors communities about the rights to protection in the context of infectious diseases, their demands for compensations, for due compensations for their work in this heightened crisis time. So it became clear to us that the virus is giving us a lens through which we can look into this very system through which we are being ruled, but also in more experiential ways, experiences with underprivilege, with poverty, with socioeconomic conditions, and so on.
Thank you, Lina. The Economist magazine has ranked Egypt second worldwide in the global normalcy index, an index that is designed to measure return to pre-COVID life in any given country. Meanwhile, the World Health Organization has reported that as of July 2021, Egypt has administered vaccinations on no more than 5 million Egyptians in a country where adult population exceeds 50 million. How do we make sense of that discrepancy?
Egypt was one of the countries that were, fast moving towards both a practice and a discourse of stopping worrying about the pandemic as an exclusively state responsibility and more turning it into people's own responsibility. And instead, the state took up the responsibility of preserving the economy. This clash that has been classical in different other contexts was very much present at the beginning in Egypt. We did some reporting about the pushbacks, for example, at the beginning from our health ministry in order for the authorities to be able to take some staunch measures, such as the closing up of the airport, the shutting down of flights. But as time passed, it was clear that we cannot afford. It was clear by the authorities that we cannot afford complete closures, and we cannot afford the treatment of COVID-19 as a number one priority. And in the backdrop, you have an extremely worsening economic situation that's not being talked about. So basically, the decision from early on has been to abandon all these precautionary measures as manifest in curfews, closures, cancellation of flights, and so on. And to just focus on restoring the economy. So in this context, it's very easy for Egypt to rank very high on the back to normalcy index that's been published recently by the Economist. In this context, also, it's only normal that providing vaccinations to the entirety of the population has not been a priority. Of course, this falls within also a global context of disparity when it comes to how the vaccine is being produced, the control of production by the certain few companies that control the patents and the trade secrets and the technologies and so on. But we also don't see a staunch government behavior vis-a-vis making sure that they get enough supplies in order to vaccinate the population. In light of this situation, there hasn't been any campaigning in Egypt for people to receive the vaccine, and in fact, this is resulting in a massive state of vaccine hesitancy, which is something that we see elsewhere in the world. But we also know that there is a traditional state responsibility around adopting vaccines, especially when they are very new. This, situation of newness. There is this, trust in the state in making you believe that you need to take this in order to be okay, which has been our experience with polio, for example, in the past. So there hasn't been any campaigning because there aren't vaccines, and as a result, people are quite fearful of this substance. And again, as a result, we have very few people being vaccinated.
Thank you so much, Lina. In many countries, civil society organizations have played a key role in raising public awareness and in managing pandemic relief. What have you been seeing in Egypt?
In a context where there are so many restrictions on the work of civil society, so we don't expect much of a role in any form or way. And then you have this twin reality that there aren't enough vaccinations that have reached us. On the other hand, we don't have much beyond that. So there is a feeling that campaigning for something that doesn't exist is not so much needed, and hence I can't really point to an active role by civil society with regard to the vaccine in particular. There has been an important role by civil society initiatives, civil society groups, both formal and informal initiatives in more sort of humanitarian assistance, let's say, at the height of the crisis. So distribution of oximeters, of oxygen cylinders, organizing access to hospitals when hospitals have become saturated, and a few organizations and also initiatives, popular initiatives, let's say, have played, I think, a central role in providing relief in these hard times, especially at the heights of our different 3 waves. But beyond that, there isn't much else.
Lina, what, in your opinion, are the most underreported COVID-19 related stories in Egypt?
What I can say is that one of the hardest stories to be able to tell is one about the deaths, about the high death rates, for example. It's not clear up until now why the death rates in Egypt have been quite high, and the extent to which there is an element of negligence, or a structural element of health sector failure in terms of immediate access, providing immediate access to those in distress. Or something related to the severity of the infection or the variants that we've been having here. These have been sort of dark spots that we haven't been able to. We tried. We produced a few stories here and there about them, but they have been quite hard. And for me, one of the main things that hasn't made it to public consciousness is actually the high level of mortality amongst doctors. This is one of the things that makes me feel that it's not just about a repressive state. It's as if there's no society anymore. Like, there's so many doctors amongst us dropping dead, and I felt for a moment that this is going to be the entry point of a heightened awareness about this pandemic, because we just spoke about how there isn't much of an awareness or a concern about it. And then you have all these doctors dropping dead in the hundreds, no coverage whatsoever, no proper coverage beyond the numbers, and no societal reckoning of this situation. Let alone, of course, no proper reflection on the demands, the rising movement, I would say, even amongst the doctors community about the rights in light of this high mortality rate and so on. So I feel like this is an area that hasn't been covered properly. The death rates, the doctors' resistance, even though it was well pronounced, especially at the beginning, but it did not amount to a highly resonating sort of movement. We were the ones who were trying to amplify it, to give it voice and so on. But for whatever reason, this movement didn't end up getting any resonance. And of course, part of it is, lack of organizing, weakening of syndicate politics, all these different reasons amounted into a situation where the voices of the doctors were not heard, to the point where, like I said before, they are dying and people are not reckoning with this terrible reality.
In contrast, what you're just saying, Lina, regional leaders have been referring to Egypt's handling of the pandemic as a success story. How do we make sense of that discrepancy?
And one of the main ways in which I see this pandemic is, how do we produce knowledge? Because there is a reason why the pandemic was produced into a crisis in contexts of Europe, whereas it hasn't been the case in a context like Egypt. Even though we had moments where hospitals were saturated, where people were dying, where infection levels were quite high by, sheer reported experience and not necessarily government numbers. And the gap is really what's the story that gets out? What's the story? To what extent is the story being controlled? So it might be simply a question of narrative control, but also narrative control does not explain how the overall situation was not really produced into a crisis. And I feel that the production of crisis was, in other contexts, was governed by two things. The real facts of, and the real sort of known facts of people dying, of huge numbers, high infection levels per day, and all of this is, of course, numbers that and on the other, how states publicly took up very staunch measures that are unprecedented, from lockdowns to closure of airports and so on. So there was a huge perception of crisis. The situation in Egypt from day one was, ما فيش حاجة قوي يا جماعة, it's fine, there is no big crisis, there's no big deal. And I feel this has been key شوية, and it's both a practical aspect, manifested in not sharing information, manifested as not taking a lot of measures and so on. And it's also discursive. So never has COVID been produced as a major crisis in public discourse in Egypt at any point. You would find everyone once in a while the minister saying, "Ya jamaa, be careful, wear your mask," or whatever. But that's the extent of it. So, so there hasn't been a production of crisis on practical or on discursive levels that basically ended up turning Egypt into a success story. Now, whether there's a crisis or not, this is what we don't know,
And this brings us to the end of our episode. Thank you for joining us. We will see you next time.